Hello, my name is Adriana Haws, and the topic assigned to me is specific phobias. It is a very interesting field of study in psychology due to the immense range of specific phobias patients have developed. A specific phobia is categorized by a marked and continued fear of a specific object or situation that causes significant life interference or distress. Fears are quick and adaptive responses that permit a powerful reply to imminent threats. Less adaptive phobias are extreme indications of fear to objects or situations in the absence of proportional danger. Although the utility of fear is accepted, the nature of phobias is controversial. A fear conditioning based explanation was the initial way psychologists diagnosed a specific phobia. Specific phobias originate from pathways and additional routes developed through information learning pathways. There are four subtypes of specific phobias. Situational. A few examples would be a fear of enclosed spaces or flying. Natural environment. A few examples would be a fear of heights, storms, and water. Animals. A few examples would be a fear of snakes, spiders, and dogs. And blood, injection, injury. A few examples would be a fear of dental or medical procedures. Diagnosing is relatively straightforward. The patient seeks medical help and explains any pertinent information to a licensed psychiatrist. The problem, though, is not the diagnosing. Rather, it's the patient's reluctance to seek out help. A majority of patients who present signs and symptoms of having a specific phobia are hesitant to seek treatment despite the availability of effective interventions. Many believe that their phobia is untreatable or that they are unaware of effective and available treatments. Patients with specific phobias are usually reluctant to seek out treatment due to the nature of the treatment itself, which is to face the specific phobia head on in a safe environment. It is a direct contact with the phobia that keeps these reluctant patients from seeking help. If the patient does not actively seek treatment, there are many methods to help the patient overcome their specific phobia. Some of the top treatments available include systematic desensitization, which is to teach the patient to relax voluntary muscles during imaginal confrontations with the feared stimulus. Imaginal exposure. The patient imagines a confrontation with the feared stimulus. Virtual reality and computer-assisted exposure, using technology to confront their fears in a virtual manner. And cognitive therapy. Patients are taught to identify and alter their faulty threat appraisals, maintaining the phobic reaction. The efficacy of active treatment compared to non-treatment is not surprising, but worth mentioning. Those receiving treatment showed active benefits compared to those untreated. Through 33 studies from 1977 to 2004 that included 1,093 participants showed that those who received treatment over those who didn't were 84% more likely to recover. In conclusion, accumulated evidence suggests that at some point of processing, functional specialization is lost. Thought and behavior are controlled by emotion and cognition conjointly. This means that behavior cannot plainly be separated into cognitive or emotional categories. Individual brain areas do not work in isolation, but instead are part of connected networks. Seeking out treatment for specific phobias will produce a positive outcome more than not. The chances of recovery are high and require little drug intervention and extensive treatment. Confronting the fear is the most difficult part of the treatment. But once the patient begins the treatment, each subsequent treatment becomes easier for the patient. In rare cases, the patient is unable to overcome the specific phobia, even with treatment. More education regarding successful treatment may decrease the amount of patients suffering from this very treatable condition. Thank you.